in, out, and when they breathe out, you just pull out. That's it. So this is what the balloon looks like on the inside.
That's what makes it get stuck in there.
But how would you even know it's doing that inside?
Because you kind of pull back and you'll feel it. If it doesn't inflate, then it'll just come out.
Oh, okay.
Yeah.
And that big tube's going into the little opening?
Yeah, and this is a 14 French, so it's small. Standard is 16. On men, like that have an enlarged prostate, they may when they have the prostate surgery, they use like 24 French, so that's really big.
Is that painful for the woman?
It's some pressure. I've never had one, so I don't know.
It's not comfortable.
It's uncomfortable, but it doesn't hurt.
So you've been
Her
anchored.
on what?
Did she win?
All right, now the difference in men. Oh, so if you want to do it, if you want to do a specimen collection after you've anchored your Foley catheter, the very first urine that drops into the bag is considered sterile, and all you have to do is just pull this out, and then you can just squeeze into here. But it has to be right when you anchor this. If you go back, 15 minutes later, you can't. Nope, it's not sterile anymore.
What if we need to get a sterile sample after the fact? Let's say the patient already has one.
Nope. What you do is you make a clamp. You make a clamp. So you can either put a clamp or you can get a rubber band, and you can actually clamp the Foley for about 15-30 minutes, and urine will just collect through here. You take a syringe with a needle. You clean that, and you draw the urine out. So this through here is sterile.
Why is it not sterile in the, like, because of
Room temperature is starting to grow bacteria.
It's already settled.
So if you need one still, you just clamp it anywhere along this tubing. You just clamp it. And when it gets urine in here, you just take a syringe.
As long as they're voided.
Mm-hmm.
Not you gotta wait.
Well, with the Foley, they should be always producing urine. Because it's just continual flow of it.
what is this thing for?
That is just like if you want to clamp it to their. It used to be if you want to clamp it to their bed, but we don't do that anymore. So this is an old one. So now they have a leg strap, and you just kind of secure it to their thigh. But they used to put plug it to their gown or do whatever. But we don't do that anymore. So that is for female. Now the difference in the male is the positioning and how much you anchor, or how far. So on a male, I gotta change my mind.
It's a guy.
Thank you. Yeah, so you'll have to do this on your mannequins too, so you can practice both.
I've never seen a whole
What kind of eye is that?
Men are easier. You don't have to look for anything.
Yeah, we are.
It could be off.
All right. And on the natural male, the anatomy will be higher. It wouldn't be so low in between the legs. So your setup will be right across the thighs. But this would just go under here. And you could still use this to target where you're going if you don't know where you're going.
I wonder
Hopefully
where.
you know where you're going. And then this would just basically be over the thighs. Even if they're awake, you just do it right over their thighs. That's how we do our setup. And then you have this. So you can either use this tray or not on the men. Typically don't. So all of this would be in here.
So what French size for the male?
It can still be 14, 16. It's where they do the prostate surgery. They'll do the 22, 24, 26. And that's because they need the blood clots to come out of the body. So if it's this small, then blood clots are not going to come out. So it has to be a bigger opening than that. So that's why they'll use the really big 28 French.
Jesus.
Yeah. But they're put in surgery, so the men don't feel the insertion of it. So you just have everything set up. You have your swab sticks open. And for this, another trick that you can do, and I'll show you, what they do in the live setting, they just open the KY jelly and they just insert it in there. And that just
painful
holds it.
when they're awake.
For the men, yeah, they definitely feel the burning because you're going in a lot further. On women, you're going 3 to 4 inches. On men, you're going 7 to 9 inches. You're going all the way to this Y, and you don't stop. Even if you see urine, you go all the way. So with the men, same thing. Whatever hand you put down first, it stays down. So you grab the penis, and you're making sure that you know where you're going. If they're uncircumcised, you have to retract the skin. So that's where you're pulling the skin back. So you retract the skin. You take your first swab stick. You go from the meatal opening back to where your hand is. You toss. Second swab stick, again, you go from the meatal opening back to where your hand is. Toss. Third one, meatal opening back to where your hand is, and you toss. And then all you do is you just take your Foley. And then you just go in.
Yeah.
And you'll start to see urine before you get to the Y. You just keep going. The man is saying, ouch, that hurts. I'm almost there. It's okay. You hold it in place, and then you anchor.
What is
After
anchor
it's
now?
in, then you pull and tug, and then that's it.
I think it's coming out through the tree.
And that is it. So the difference is just that you just do it over the thighs. And then you have to go all the way in before you stop. And you'll see urine before, it doesn't matter. You keep going. Because you want to make sure you make it past the prostate into the actual bladder.
So you'll see urine through the tube or just coming out?
Through the tube, yeah. You'll see it just start flowing out.
Is it something different because at Larkin when we saw both I saw male and female, but the kids themselves didn't have the swabs. They had just the iodine and then the in a pack, and the nurse just put it on to the cotton. Like
Yeah, it can be that way too. Yeah, either way. Either way the kit is made. And then the same thing to remove, you just attach your syringe and you just wait till it stops. And you tell them take a deep breath in and to exhale, and when they breathe out, you pull out as quick as you can. And then they're just going to feel burning. Oh, that burns, but it's out. And then that's it.
Was it how does the condom catheter?
The condom catheter goes on like a condom. And that's it. It's nothing invasive, so there's the risk for infection is lessened. The only thing is that with the condom catheter, you have to change it every 24 hours. And it's all in the technique and how you wrap that adhesive around it. Like the tape around it, you can't be too tight, can't be too loose, stuff like that. But it has to be changed every day. But it's not invasive, there's no risk for the infection. And with the condom catheter, you have to leave room at the tip, because if you put it on all the way to the tip, then urine can't come out. So it's all in the technique that'll make or break the condom catheter. But I haven't seen the condom catheter used.
It's a mess.
Right now, no. The better hospital and then the patient I went to go see, whatever, he had the condom. I mean, I wasn't gonna ask to see it. I was just like, hey, I know he had it on because I had asked, and he was like, oh, he has a condom catheter on.
Okay.
But I was intrigued to see it, but.
Yeah.